behalf of Bangalore Chamber of Industry and Commerce, we welcome you all for this exclusive session on creating sustainable culture of health and well-being in the workplace ecosystem. The session is organized under the aegis of HR and Women Empowerment and Leadership Expert Committee, BCIC. The Chamber expresses its grateful thanks to Mr. Nandan Bhatia, who is the Director of Healthy Workplace Program at Arogya World India Trust, for accepting our invitation to address at this session. Thank you very much, Mr. Bhatia. We now have Ms. Lavanya, who is the co-chairman of HR and Women Empowerment Expert Committee, and she is also the COO of Zivame. Before I hand over the platform to Lavanya, the Chamber would acknowledge our member organizations for supporting all our annual events. They are Bueller, Fundermats, Wipro, MTR, and Sona Group of Institutions. Thank you, the sponsors. And over to you, Lavanya.
Thanks, Rupa. Okay, I think so. It's a thanks to all the participants for taking out time to actually talk about something which is very important. I think so. Post COVID, whether it is young or old people have kind of started taking conscious effort about how can they improve their health. So there is always this proverb of saying that health is wealth, which also means that one's health is the greatest wealth. And this does not kind of stop at only, say, at a personal level. The corporates today are obviously kind of, understanding the need of maintaining good health for their employees, considering that, 1/3 of our lives are actually spent at work, so the working environment, what is provided, it has a significant impact on the health and well-being of our employees. So today's session is actually going to kind of cover about what it means, what does workplace health mean, and what are the well-being programs which the corporates are kind of taking to, and the initiatives and the activities which the corporates are designing to kind of making the workplace more healthy, giving choices to the workers to adapt to these also. So we'll hear more from our speaker today. So today's event, the Healthy Workplace Program, is scientifically designed and is an evidence-based and an efficient program which defines positive outcomes and has been developed with the intent of advancing the workplace health movement in India. Okay, so this has been adopted about 165 reputed companies and across various industries. So I have a listing: Infosys, Capgemini, ABB, Toyota, Dalmia. So across Reliance, Bayer. So many industries have adopted it and they have seen positive impact. So this coverage has been about for 3.3 million employees. So we can say it has been a significant movement when it kind of comes out here. I take pleasure in actually inviting our speaker, Mr. Nandan Bhatia. Ms. Nandanji, can you just come on video, please, as I introduce you? Nandanji, can you hear me? Rupa, can you hear us? Can you hear me?
Yes, clear, Lavanya.
Nandanji, he's not able to hear us.
I'll just call him, Lavanya.
You call him. I'm just doing his introduction. I hope. So we did the
Can
testing.
you hear me, Lavanya?
Yes. We can hear you. Okay.
Sorry, there was a technical
Yeah, thank you,
glitch.
sir. Thank you to come on video. We just wanted to kind of introduce you. So Mr. Nandan, who's there with us, he's an industrial leader with diverse expertise and skills as entrepreneur, people leader, operations manager, and as a social contributor. He has more than 23 years of experience in establishing, growing, transforming the business across mid to large scale initiatives and has led various high-value projects across, various sectors, including FMCG, IT, hospitality, and now he's actually working on a non-profit organization. It's my pleasure to again announce that he won the prestigious Namma Bangalore Award, the BCIC Startup Award, and the Karnataka Seva Ratna Award towards leading the environment and sustainability project successfully. He's currently the director at the Healthy Workplace Program, and his capabilities include workplace health, driving change, business transformation, people leadership, technology adoption, and social responsibility. We have tried to actually give an introduction, but I think so no words are enough for the amount, the kind of work which Mr. Nandan is doing. So I'm not going to, without further ado, I'm just going to hand over this to hear from Nandanji on what he's going to kind of talk about us. I again thank all the participants to kind of join us today on this very interesting topic. Over to you, Nandan.
For the kind introduction. Hope I am audible and you can see me.
Yes.
Okay,
yes.
great. So, today's session of creating sustainable culture of health and well-being, especially in the workplace ecosystem, is the most critical subject which is being discussed. And I'm glad that it is aligned with the vision of BCIC, Bangalore Chambers of Industries and Commerce, which is look beyond and together we should. So that's a theme, we are trying to integrate today. While I have prepared the presentation on healthy workplace, how you can adopt the best practices, how can you be in the league of healthy workplaces in the country. Now, we referring the current subject of COVID-19, you've seen the coronavirus global pandemic has affected every workplace in the country and each one of us in one way or another, right? And the prolonged lockdown has forced companies around the world to adopt new ways of working and doing businesses from a large enterprises to medium and small, which experts believe now will become the new normal, right? And this unprecedented crisis has actually reminded us of not only keeping our surroundings clean in terms of maintaining hygiene, but also taking care of our own health, eating healthy food, being physically active, and much more, right? Now, every industry leader is talking about return to work, which is becoming a major challenge for all business leaders. And I strongly feel that priorities have to be carefully worked out and should be implemented as and when employees come back to work, right? We have seen corporates getting their workforce to 50% and above, and the numbers percentage is increasing, right? Uh, However, with increasing worry and stress among employees, right, who have now migrated back to their hometowns and under the concept of work from anywhere, the organization's role in sustaining employees' health and mental well-being will become more important than ever. And I think that's the priority every business leader is having now. So in this context, today's session, I will be majorly focused on critical insights on how companies and a leader can plan to draw up the business continuity blueprints, uh, keeping health, happiness, and productivity of employees in mind as a critical factor, right? So today we will be talking about how you will get the clarity, how you will get the responses on some of the open wide questions, such as what are the key priorities of the organization, enterprises, SMEs when employees return to work, right? The second one is the effective workplace management, emphasizing on employee well-being under the current scenario, right? Also very critical is the how the companies are drawing up policies and the processes for business continuity. And is your company prioritizing employee health and mental well-being? Is again a big question mark, while we all are working towards the business profits, right? And how to take care of health and mental well-being if hybrid work status quo continues, right, under the current scene. And last not the least is very critical is Arogya World's Healthy Workplace program, how we can offer to help companies advance in their journey towards employee health and wellness, right? So these are, some of the context and the points which we will be discussing, and I want to make very engaging and people to understand. So there is a presentation which I have prepared, and also there's a small AV which I would like to play, and we will have a Q&A at the last 15 minutes of the session, and I would request participants to please come up that how we can support and work together and collaborate towards creating the sustainable culture of health and well-being, right? So allow me to share my AV screen, and we will take it forward. Lavanya, please tell me once you can see the AV and you can hear the sound.
Yes, yes, Manoj.
Right. Can you see my screen?
No, not yet. You're still on, you just need to.
Sure, just a minute. Is it visible?
Yeah, we can see a screen. You can go to the AV.
Can you see my screen?
Yeah, we could. Yes, yes, you can play it actually.
Okay. So I'm just, giving you a glimpse of Arogya Worlds as a global non-profit organization towards advancement of workplace health in India and how we are doing it. And then I'll take you through the presentation, right? I'll play the AV now. As India looks towards faster economic growth, maintaining the health and productivity of its working population is key. With the Make in India campaign, the Indian government aims to transform India into a global design and manufacturing hub. Along with that, there must also be an increased emphasis on employee health at workplaces. 2 in 3 Indians are impacted by diabetes, cancer, heart diseases, or other non-communicable diseases. When compared to other developed countries, the onset of these conditions is at least a decade earlier among Indians. One smart way to contain the damage caused by NCDs is prevention through health education and lifestyle change. People spend more time at work than they do at home, which is why workplaces become key platforms in enabling lifestyle change. Arogya World started its Healthy Workplaces program in 2012 to leverage the workplace as a platform for NCD prevention. We conduct meticulous audits of workplaces to evaluate their health standards and recognize companies as healthy workplaces at annual conferences where best practices are also shared. The healthy workplace criteria, co-created with industry, are organized in 3 levels: bronze, silver, and gold, and includes guidelines such as no tobacco use policy, easy access to healthy foods, and opportunities for physical activity. There's also a platinum certification reserved for exemplary workplaces, which is a data-driven leadership initiative. At this level, Arogya World helps in tracking the extent to which employee health has actually improved as a result of the various health initiatives and programs in the organization. Once we evaluate the level of health standards being maintained at a workplace, we conduct lifestyle modification classes, educational webinars, and Maithali programs to help employees make sensible lifestyle choices. Through these measures, we also enable workplaces to level up their health standards. In 2020, Arogya World launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2020, Arogya World has recognized about 145 companies impacting the lives of more than 3.1 million people. We couldn't have achieved this milestone without the able support of numerous companies, like-minded agencies, and foundations. We are happy for this support and grateful for the partnerships. With our emphasis on clear benchmarking criteria, rigorous assessment process, great conferences, and our team's passion to improve the physical and mental health of working Indians,
Arogya World has definitely advanced the dialogue on workplace health in India.
Thank you very much. Lavanya, can you see my presentation slide now?
No, you need to switch. It's still on the AV.
Is it, can you see
Yeah,
now?
now, yes, yes. You can put it on
Wonderful.
presentation mode. Yeah.
Sure, sure. Okay. So, continuing forward, we have seen that how, COVID has impacted the overall business environment. And there is a clear understanding which has brought in that wellness is no longer a good to have feature, but it's a must have fundamental, right? And that's why worldwide the companies are advising employees to adopt simple health measures, which is very critical in terms of physically and mentally to be upbeaten, right? And as there is a saying that epidemics don't last long, but the learnings from the epidemics will last very, very long. I would like to, quickly share some of the data on a research conducted by Gallup, World Economic Forum, and Mental Health Survey by LinkedIn. And we have seen that, the companies who have been adopting the best practices on employee health and well-being, and 60% of them have said that, the employees reported that workplace wellness programs reduce their company's healthcare cost, right? That's the 60% of the population which is being surveyed and said. 50% survey results say that working adults globally say that they have experienced increased anxiety around the job security, stress due to changes in work routines and companies, right? They feel lonely or isolated working from home, or have difficulty achieving a work-life balance as a result of the COVID-19 pandemic. Third point, which has come out very loudly, is again that Indian professionals are really feeling vulnerable to job uncertainty and financial instability, which has been bearing their mental well-being, experiencing increased stress or anxiety, right? And the fourth part, where it's 70% of all deaths worldwide are happening because of the chronic diseases, right? And as per Evelyn Kotum from WHO, he says that it's unethical and short-sighted business practice to compromise the health of workers for the wealth of the enterprises, right? So this is the importance today what we are talking about. And if you see the NCDs is a bigger problem for more than 1 billion population in India today. And the survey also says from WHO that 63% of the people die from the NCDs, and 75% of adults are diabetic or pre-diabetic, and approximately more than 80 million people are having diabetes, and around a similar number are pre-diabetes. So this is the major concern, which obviously we cannot live with, and I think it has to be addressed in a very sustainable manner. And the global economic output loss by 2030 is being said as 47 trillion, right? So these are the some of the issues which we are seeing as a number. Now, why this problem is being arising, right? You will see that because of urbanization, modern lifestyle, big tobacco and big food, and health system, and also the employers. Now, if you see, I'm focusing more on the workplace perspective, and there are certain challenges at the workplace, which is unhealthy eating, smoking and alcohol consumption, right? A busy lifestyle, if you see, and low awareness to the health risk, right? People do not give more importance to the health and mental well-being in this perspective. And very critical we have seen is sedentary lifestyle and the mental stress which people, especially employees, are going through. And fourth is again critical thing is the low compliance to risk-based medical surveillance problem, right? So these are some of the impact which is coming, and we have seen it is becoming a major problem for the employers in terms of seeing the reduced absenteeism of the employees, decreased productivity, and so on and so forth. Right now, what is the solution? We know the problem. Now, what is the solution? And as you rightly said, right, it's about the prevention, right? Now, according to WHO, it says that a healthy diet, physical exercise of at least 1 hour on a daily basis, plus avoiding tobacco, can actually prevent 80% of the premature heart diseases and 80% of the type 2 diabetes and 40% of the cancer, right? So this is the prevention program which we are trying to adopt and encourage companies to implement sustainably, right? Now, if you see, the corporates have done a great work from a workplace health perspective. They have been promoting healthy eating habits, drive the right concepts, implement the right measures, and leading by example to make sure the workforce is best set up to tackle any kind of possible illness or diseases, promoting physical exercise, right? Communication, various communication, conducting the group sessions, and so on and so forth. And also the mental health, where they are providing the EAP programs, minimize stress and burnout by running mindfulness and meditation session. These outcome has come out from our survey when we did for the enterprises during COVID-19 work from home, right? Now, from an introduction perspective, now Arogya World plays a very critical role from an India perspective, where our mission is to prevent the non-communicable diseases through health education and lifestyle change. And we have got a great partnership to work with, because it's impossible actually to reach the grassroots level and address this issue. For our efforts from last 10 years, we have been recognized globally and nationally as Ashoka Fellow. Our CEO and co-founder, Dr. Nalini Saligram, is an Ashoka Fellow, and we have got a millionth award winner, UN Every Woman, Every Child Commitment, and recently Google AI Award, right? Now, if you see, our health model is where we make prevention accessible, where people live, learn, and work. And there are approximately 6 million plus till date we have reached through our various programs, that is Diabetes, Healthy Schools, My Thali, and Healthy Workplace. We are proud that till date we have recognized progressive companies to the tune of 165 in India, which is spanning over 4.9 million employees. So this is the count what we are talking about, and our aim and vision is to reach at least 25 million in the next 2 to 3 years, right? Uh, our big vision is obviously the India's billion plus people to lead healthier lives and thereby contribute to the best of their potential to the society. And we see that our program is aligned with India's Sustainable Development Goal number 3, and Ayushman Bharat, Fit India, Eat Right campaign, Poshan Abhiyan. And today, what I'm talking about is creating the sustainable culture of health and well-being through our Healthy Workplace program, which is very important for every organization. And we have seen that these are shown the proof of concept. These are science-based work with evidence-based advocacy, and we are committed to the impact measurement. And obviously, these are very thoughtfully designed programs and are population level impact, right? So that's the crux of the discussion here about the healthy workplace. In our journey of creating the workplace health movement in India, we are thankful to the organization globally, again nationally, Stanford Medicine Center for Asian Health Research and Education, Public Health Foundation of India, Confederation of Indian Industry, Reliance, Wipro, Infosys, Ambuja, J&J, and so on and so forth, right? In terms of our evolving healthy workplace program, I would like to take at least some moment here to make you understand about that how you can join the prestige and stellar companies who have been doing great work and have been recognized as Arogya World's healthy workplaces, right? So as a first step, companies apply to become an Arogya World healthy workplace. They undergo a preliminary assessment that comprises of a questionnaire which has been designed in guidelines of WHO standards to identify the program interventions instituted by the company to advance employee health, employee engagement, and experience as key evaluation matrix, right? And step two is that our expert assessment of a three-member comprising of a medical doctor, industry leader, industry expert, and an Arogya leader conducts the online assessment where we evaluate the initiatives taken by the companies and meeting with the respective department. And this is being done online currently under pandemic. And step three is based on the robust and transparent evaluation process and overall information shared by the company. Arogya World Healthy Workplace levels companies as bronze, silver, and gold, which are determined, and the respective companies are subsequently felicitated at our annual conference and award events where they get an opportunity to talk about their best practices. These are qualitative analysis which is being done under BSG, that is bronze, silver, and gold level, and subsequently comes a platinum, which is majorly focusing on data driven, right, where we track the matrix, right? And it's a journey of 2 to 3 years in terms of creating the culture, sustainable culture of health. Now, if you see the assessment criteria or the questionnaire which has been designed in guidelines of WHO is being categorized into two important pillars, which is physical health and mental well-being, right? Which has been introduced last year during pandemic. And physical health majorly focuses on tobacco policy, where we talk about no smoking or use of smokeless tobacco and other tobacco products throughout the campus, about reimbursing nicotine replacement and non-pharmacological to support the tobacco cessation programs, right? And secondly is healthy eating, where we promote healthy eating to all employees, including those working from home, right? And third one is a physical activity where we see how companies are promoting and offer access to on-site and online group exercise sessions, yoga, Zumba, aerobics, etc., etc., and how they are allowing employees to take physical activity breaks during the working hours, which is again very important, and provide, promoting the overall physical activity in their workplaces or even they're working from home. Uh, Fourth criteria is shifting mindset, where we are talking about and promoting leadership, which is a key to success, right? So how employee health and well-being becomes a goals in managers' appraisals or scorecards, which is again a very important aspect to motivated teams by rewarding health goals and achievements of the team. Also identifying the change agents or ambassadors to champion healthy workplaces within the company, right? And so these are the physical health criteria. And under mental health at workplace criteria, which includes promote well-being, where we are talking about a zero tolerance policy for workplace bullying and protocol for complaints of any kind of form, which is emotional, physical, or sexual harassment, right? Again, a mandatory mental health and well-being module in workplace induction, where the new employees are joining, or a training, sustainable training for all new employees when they take these initiatives in their lifestyle, right? And then the managing stress, which is again an important aspect, where we're talking about trained managers and occupational nurses, physicians in the workplace in identification of early signs of stress, right? Burnout and mental and substance use disorder, which actually, if you see, impacts on the productivity, which gets decreased, right? So these are, some of the targeted early intervention strategies which companies can adopt and have been doing for employees at a high risk, especially for the mental disorders. I know in India it's not being very vocal at this moment, but we are seeing that how companies are doing the EAP programs, and employees are coming forward and talking about this. Again, under this, leadership plays an important role, that how a leader is investing in making a mental health program sustainable, right? How the affirmative recruitment and career advancement policies for persons with psychosocial disabilities is being provided, and how company leaders are continuing monitoring and evaluating their best practices, right? And again, last not the least is the supporting recovery and the others, that how companies are training mental health ambassadors in delivering peer counseling to employees in need, right? So these are the critical criteria for any organization to establish in their workplace to have a sustainable culture of health, right? Uh, Now, coming to the important aspect of quantitative analysis, where we focus more on category on platinum healthy workplaces, and we have seen till 2021, more than 35 companies are recognized as a platinum healthy workplaces who have been promising health trends in their organization. And great results have come as a proof of concept that companies who have been data driven are actually seeing 28% reduction in smoking or tobacco use, approximately 48% increase in employees who exercise regularly, 30% reduction in stress has come out during the surveys, and 17% increase in those that completed health risk assessment. So you can see how important these are the elements for creating the health and well-being practices in the workplaces. Now, coming back to our role of Arogya in terms of the advancement of workplace health, we have seen through our program, we are providing the solution to companies to better manage COVID-19 kind of pandemic, and especially other chronic diseases, which are going to be there, right? Healthy Workplace Initiative actually is been advising companies to invest more in employee health and wellness through our pioneering awards. And we have seen our innovative approach actually leverages workplaces as a platform for lifestyle disease prevention, since Indian working spend maximum time at the workplaces. And most critical is we become their advisor as a strategic partner and provide the evidence-based, data-driven, and outcome-oriented solution towards employee health and well-being, right? So that's a role we play. Now, how do we play this role? How do we help organization to take the mile forward and create this journey? This is through our scientific-based tools and program, which are thoughtfully designed. So these are important, like lifestyle coach program, Maithali, and communication package what we provide to companies is a part of the deliverables of healthy workplace. Now, taking some more time on explaining you on the lifestyle coach training, that why it's important and how it is actually helping organization to address the problem statement today, what we have discussed, is that Arogya World brings this proven program, which is our offering, where we train the smaller group of your employees to become the lifestyle coaches so that they can further roll out the program to especially to a high risk employees in your organization who are either having the heart related problem or diabetes or other chronic diseases, right? So we do the we conduct the train the trainer program where we encourage companies, enterprises to nominate 2 to 3 employees who have been trained as lifestyle coaches in group settings, right? And the coaches in turn will conduct 16 weeks behavioral change sessions with small groups of high risk employees in the company, right? This is being trained by our master trainer from Emory University in US. So we will give the coaches all the material and the training needed, which is critical for addressing this subject, right? So this is about the lifestyle coach training program. And most importantly is Maithali, where we are promoting healthy eating practices, and this particular tool is addressing the most common challenge in the organization in terms of healthy eating, where people are confused about what to eat and in what quantities, because it teaches people about the importance of portion, which is good nutrition, and portion, right? And how do we do it is very simple step where we have defined into 5 levels, where we organize the educational session with My Thali subject matter from Arogya World who's specialist and nutritionist. The aim of this session is to equip the company with the knowledge to lead healthier lifestyle by eating right. So that's the most important element. Step two is we conduct an audit of the food menu available at your cafeteria with suggestions of healthier additions and alternatives, right? Step three is majorly based on the observation and the cafeteria menu plan shared by workplace. Our nutritionist conducts an assessment and suggests ways to improve healthy eating options in the workplaces, right? And step four is where we share various long emails in terms of creating awareness, eating right tips with the HR of your organization, where they can send them to the interested employees, and also promote my thali with chef demos, posters, danglers, flyers, and we can conduct a lot of such events in your workplace where we are promoting healthy eating, right? And last is that we send a simple questionnaire also to employees and to your staff to assess eating pattern of the employees, which is very important, the pre-assessment and the post-assessment of the program. So this is how we implement My Thali. And again, the communication package where it focus on creating more awareness and the prevention program. And we give a lot of content through emails, which can be circulated to the employees in the whole journey of 2 to 3 years, right? So I think it's very important from a company's perspective that you need to transform your organization into a healthy workplace. Now, what's in it for companies? Why do you want to take the healthy workplace program, and what change it will actually create in your organization? So first important element is it will help you to gain a clear understanding of your current practices and the policies, and most importantly is it will give you the benchmarking of the program to the global standards through our 165 companies whom we have recognized till date, spanning more than 4.95 million, as I said. It will help an organization to structure a holistic employee well-being strategy, which is the need of an hour, which will encompass physical health and mental well-being. And also it will increase the employee productivity with reduced absenteeism, higher engagement, and reduced sick leaves. And the organization can become the employer of the choice by attracting and retaining the top talent. So these are the things which is very important, and companies have seen through the creating the culture of health and well-being. We have seen getting a good feedback and positive testimonials from the large and reputed organization where they fully endorse the program, where they said that they have got the benefit from participating in Arogyaval's program by getting scientific and evidence-based approaches for prevention of NCDs and better networking opportunities with agencies working in the area. Similarly, companies have got a benefit with a partnership where they have implemented various policies, especially tobacco at the workplace, and teaching employees about healthy eating, such as balanced diet and work-life balance, right? So, these are some of the testimonials I would like to highlight, that how companies have taken this program seriously and they have sustainably implemented this. We have seen stellar companies, progressive organizations, such as Texas Instruments, Bosch, ABB, Dalmia, who have been recognized for their great work and who have taken the leap forward to implement the practices, right? In 2020, during the pandemic, organizations like Adani, Rubrik, Juniper, Cummins, Tata Projects, MediAssist, and so on and so forth, companies have been awarded. Similarly, in 2021, organization like, the global organization like Danske IT, pharmaceutical giants like Bayer, Xiaomi, even the Kempegowda International Airport, Bangalore, Blackstone organization like Nexus, WNS, Connect Corp, and so on and so forth, companies have been recognized for their best practices, and they are getting a lot of benefits from Arogyaval's Healthy Workplace program. In our journey, we have seen that our partners have been really helping us, and this award which we give of Healthy Workplace is in association with Public Health Foundation of India, and the companies who are working more on the data-centric and being given as a platinum plus level. They have been recognized as a global center for healthy workplaces. We are thankful to the BCIC and other organizations like NHRD, Micrographio, Cigna, and AUSD in this journey of health and well-being. So this is a quick presentation on creating the health and well-being practices in the Indian culture of organization, and I'm happy to open the session for the Q&A. If you have any questions, please shoot it here, and I would like to answer that. Over to you, Lavanya.
Yeah. Thanks, Nandanji. That was really an interesting presentation on what corporates can really do about promoting overall health of an employee. While we are just waiting for people to put in questions, one of the things while I was seeing the presentation and what was coming to my mind was that a lot of our members, at least in BCIC, are from the SME sector. Like who are like SME. So they might not have that large network and all that, what your Arogya Health Center is talking about. But actually there seems to be scientific reason to adopt what you're suggesting, right? So how do you think a small setup people can kind of adopt your philosophy?
Thanks, Lavanya. This is a very important question, and that's what I remember our discussion with the Commerce and Industry Secretary, Government of Karnataka, that how we can create the culture of health and well-being in the SME sector, right? And that's what Arogya World actually handholds. We collaborate with the organization. We have the great engagement program, which I have explained, and which are actually comprising of where we create the assessment of the organization on their current practices through the criteria I've explained, right? And subsequently, we help to define the blueprint for the organization, right, of health and well-being, right? So we help them in creating the policies, process. We handhold them through our report, and we felicitate their initiatives in our platform of awards, annual Healthy Workplace Awards program, right? And most importantly, through our tools and program, as I mentioned, which is tools and resources like a communication campaign, where we focus on education and awareness. We provide all the data and information. They have to only disseminate it within the organization, right? We help in implementing the Maithali program, which is a trusted program by all the organizations who are currently healthy workplaces, right? We conduct the menu audits, as I mentioned and explained. We conduct the sessions with the subject expert nutritionist, right? And we again give the lot of AVs and narrated PowerPoint presentations, which will help companies and employees to understand the importance of healthy eating. And as I mentioned, most importantly is lifestyle modification, which is a behavioral change program, where we have the train the trainer program, where we lifestyle coach training program we conduct for them. We help companies through our partners to even curate and conceptualize the mental health webinar or sessions also with our partners again, and coordinating and follow up on imparting training on various aspects of the lifestyle behavioral through DPP, diabetes prevention program and all. So if you see, we handhold the organization. Obviously, it's a long journey of 2 to 3 years, where 1 year you will take to understand, what can be done, how it has to be done, creating the bandwidth within the organization. Walk the talk is very important from a leadership perspective and the leaders' involvement, right? And a consistent deliverable being defined as a KRA for the leaders to create the health ambassadors or coaches. Let me give you a small example in this. You have seen the companies like TCS, where you have more than 4 lakh employees, and they are being addressing to every employee about health and well-being. So how they are doing is they are creating the mental well-being champions, they are creating the marshals, and through them they are implementing this program. So that's why I said we have to come together, right, in this journey. It's not a one-man show that a CEO of an organization or a CEO of an organization can lead this. No, every employee has to own their own health, right? If we do not own, it will be an impact, right? So that's what. So I hope I have answered your question, Lavanya.
Yes. I think so. Wing Commander Kripakaran has a very interesting comment. I don't know if you're seeing the chat.
No, I haven't seen.
He's talking about product called Strap, which helps to better employees' posture, and it also trains the employee, and it is important by following ergonomic postures actually. So that is, so when we talk about lifestyle changes, do we even cover these kind of stuff?
Yes, it's very important. In one of the criteria I mentioned the sedentary lifestyle, right? So we promote companies, we promote employees to ensure there is a break in between. They should come out of
I
the.
think, Nandu, I have spoken to you about this, but I thought maybe appropriate just to ping you, and I just posted the details on the message section.
True,
So,
I completely agree.
It's up to you. And
Thank you,
as
Kripa.
part of a package, this also adds up your value.
Yes.
In my opinion, it adds much more value to you from the scientifically established data.
True.
So this is an award-winning product. So I thought that I'll share that on this forum. Thank you.
Sure. Thank you, Kripa. I completely agree. Ergonomic is the most important element again, where people are working from home, and we have seen that people are not working for 8 hours or 9 hours. They continue working till late nights, right? And it's an important aspect that needs to be addressed.
It has become a bonus for the employer.
Yes.
You are on the clock, on the job.
True.
Yeah. If you want to make use of it, I can facilitate and help, because this product was developed under my mentorship.
Sure.
It's like a small matchbox style, which is stuck on the spinal. You will not even know, and it programmed to the cell phone, and it communicates with you and all that thing. So depending upon,
I'll connect with you offline and discuss more on this, Kripa. This is a great thing. Thank you so much. Lavanya, over to you.
So Nandanji, Shilpa Narayanan is asking, what's the minimum employee for an SME to collaborate with HWP?
See, till date, we were addressing more our program to a large enterprises who are having more than 500 employees. But today, when we are entering into rural area, we are entering into SME sector, especially startup grade, we are okay even the companies have around 25 employees plus, right? Because we want to create an impact and ensure that there is a sustainable culture of health even for a small startup, right? Because they are going to grow tomorrow. So that's what our program is all around.
Sure. Shilpa ma'am, I hope that kind of answers your question. Are there any other questions? Otherwise, while I'm waiting for people to post questions, I have one more question, Nandanji. Actually, while you say that the whole program monitors, about the employee well-being and all that, and then leadership obviously has to kind of take, say it as a mandate. So which means that most of the leaders have to kind of adopt a healthy lifestyle, right? I think so that's a big challenge which leaders kind of face, for whatever this thing, what they maintain. So how do you think leaders can lead by example?
Yeah. So, let me give you an example of my past organization, which is Britannia Industries. And I have managed a large portfolio there. And I remember, our logo and our focus was more on Britannia Cares, right? And we have seen, the leaders being walk the talk. They've been conducting sessions. There have been various employees forum. They have been talking about the best practices, which is important from a health and well-being perspective. EHS head is leading a lot of initiatives in the factory where the manufacturing units are there, right? And similarly, another organization where I've worked very closely, that HCL Technologies, where employee first was the statement, right? And that's being totally, implemented through various programs, through tools and resources. And there were the time when health ambassadors were created, coaches were identified, and they were driving this program. And now, as I just gave you the example of TCAs, it's not about the one leader or the head of the organization who can lead this program. It has to be everybody's responsibility, and they should own their own health, right, and minimize the risk,
Agreed.
right? It's all about
Agreed.
mitigating the health risk, correct? And through our lifestyle coach program, or a tool which I just explained you, and that's why we create the health ambassador and coaches, which in turn actually implement the program to the high risk employees, right? So it's a collaborative effort, Lavanya. It cannot be managed only by the leader, right?
Yes, I agree, but I just wanted to kind of hear your stories around it.
Yeah,
You know, it always kind of helps.
yeah.
I think so Mr. Srinivas Murthy is asking if we can have your coordinates. From BCIC, we will share your email ID to the participants so that in case they want to reach out to you to know more about the program, how their organization can kind of help, that will be there.
Sure.
Again, I think it's a lot of positive feedback on the program. Shilpa Narayan says that it's a great session and it's a great initiative. It will help India to boost its employee productivity. I think so people really felt the benefit, listening to you, and so from the chamber also. I think so these are the initiatives which are softer, but obviously can make huge impact and also create positive work environment for people as they kind of return to work. On a separate note, the HR committee is also working on the return to work program. We'll share the details shortly with all the participants. I'm sure they will be kind of interested to hear more about what corporates are doing about return to work also. I don't see I don't see any other questions as such.
So
Any
few
closing
more.
remarks,
Yeah. So
Nandanji?
yeah, sure. I would like to certainly, you know, uh, engage with companies, especially progressive
Sure.
companies who want to
Mhm.
invest in their employees' health and well-being, and
Mhm.
being a part of the healthy workplace program from Arogya World is certainly rewarding, because there is an opportunity to be acknowledged amongst India's healthiest workplaces. You will be getting the best practice sharing about health and wellness programs and learning from other healthy workplaces. You will be
Mhm.
able to create happier, agile, and resilient workforces, better employee engagement, increased productivity, reduced absenteeism, especially when employees are coming back, right? And you'll be a part of the Arogya World Annual Healthy Workplace Conference and Awards program, where you will be engaging with the global leaders on how to design, implement, and evaluate the impact of health and well-being programs in a sustainable way, right? So this is why I said it's very important and is being rewarding. And to conclude, I think corporates should start dialogue about healthy living, especially mental issues and wellness what employees are facing. And there is a pressing need to take a call on this and invest in the health of the employees through creating a policies, processes, and make effort in this direction. In this regard, you can certainly connect me to make your organization in the League of Healthy Workplaces of India. And last not the least, I would like to thank you to all the attendees in this session who wants to create sustainable culture of health and well-being. Special thanks to BCIC and other enterprise leaders. Special gratitude to Dr. Augustus, Dr. Ravindran, Prithvi, Niranjan, Rupa Madam, and our Arogya World's CEO and founder, Dr. Nalini Saligram, and the entire Healthy Workplace team and Arogya World for supporting and leading this noble mission, which is the need of an hour for the Indian enterprises. Thank you very much.
Yeah. Thank you, Mr. Bhatia. Thank you for taking time and addressing this audience. Rupa, over to you for closure. She'll just do a small felicitation and all that. Rupa, over to you.
Yes. Thank you, Lavanya. Thank you, Mr. Nandan Bhatia. That was quite an enriching session. And as a token of our appreciation, we would like to play a small thank you memento. Please do stay with us.
Sure.
Thank you once again, sir, for addressing at this session.
Thank you very much.
Thank
Stay
you,
safe.
Lavanya.
Thank you. Yeah.
Thank you,
Thank you,
all the
everyone.
participants.
And I hope everybody has a lovely evening and a happy weekend to everyone. Thank you. Thank you, Mr. Nandan.
Thank you.